So you treat neuropathy.
Yeah.
And we've talked about this, that you see reversals in symptoms all the time.
In our clinic, people come in with diagnosis of neuropathy from their other physician, and then when they're done, they go back and they're like, well, no, you don't have neuropathy. It must have been a mistake. And neuropathy is nerve death. Something, whether it's diabetes, car accident, long-term autoimmune condition, all those things can start making the nerve start to die.
So if you catch it kind of early during that,
when you're first getting the tingles,
slowly getting the tingles.
Yep, you'll start getting tingles, a little bit of numbness, and if you get it then, it's much easier to stop the progress.
So what do you do?
Well, the first thing we look at is, do we have enough oxygen? So we're putting a pulse oximeter on there, looking, do we have a decrease in oxygen in that area? Usually the feet, for most people, is where it's at. Then we're looking at also the amount of actual nerve flow. Do we have a robust amount of amps of actual nerve energy getting down there? If we don't, that lets us know that, hey, guess what? This neuropathy is caused by blood vessel loss. That particular version of it we're really good at. Why? Because now what we can do is take, whether injection and use the PRP injection therapy that we talked about. Okay. What is it doing? Causing padding, so that way that pressure from you walking around doesn't keep grinding and doesn't kill off the nerves. It lets the body heal a little faster. We're also going to go very aggressively with oxygen therapy. Like, we use a hyperbaric oxygen tank, but now we've actually made hyperbaric oxygen masks, so that way we actually can pump that oxygen. You're breathing, doing a specific kind of exercise to get that circulation down to the foot.
So these nerves start, unless they're dead, but if they're still hope in them, they become
because if you increase
back to normal again?
They can get back to normal, because if you're increasing the oxygen down there in that foot, in the actual blood itself, now the body can actually heal itself. So when you're looking at how these nerves are dying, they're dying because they're not getting enough oxygen, or they're not getting enough activation, or they're not getting enough protection. So we're going to use the something like a PRP to help give that insulation and protection. Then we're going to put them hyperbaric oxygen tank to increase the oxygen so there can be more viability. Now we could do the fun stuff like laser to speed up how well the tissue of the actual epithelial cells around the blood vessels actually grows. So now you've increased blood, increased oxygen, taken and created padding in there, and then we'll use the laser even towards the end of the therapy. And wow, it's actually a pleasurable experience to have your neuropathy fixed, because you got someone working on your feet.
So is it usually extremities?
Most people most people it's
like
extremities.
Feet and hands?
Yeah. Yep. Their hands are burning.
It feels like it burns. It gets burning?
When it gets really bad, it gets to burning. Yep. And then, like, for diabetics, it gets numbness and burning, because you can have both because of the damage that diabetes does to your vascular system. And your nerves don't work without a vascular system, guys.
And the symptoms go away.
Yeah.
In many cases.
They really do.
Do you have miracle stories where even you are surprised?
I'm surprised sometimes, but at this point, after 16 years, most of the cases come in, like you said, small, and then because they didn't even think I could fix their big ones. But yeah, we're seeing miracle cases, but it's not miracles anymore. It's just, what do you need? Oxygen. What else you need? Blood. What else you need? Activation. Is that anything else that as a human you wouldn't think? And that's, I think, what gets me so passionate. Be a human. Be the best human you can be. And if you do that to the world.
How is neuropathy normally handled?
Neuropathy is normally handled, they give you something called Lyrica or gabapentin. They give you a drug that gabapentin causes the axon of the nerve to actually grow a little farther, because just like anything, you move away from pain. So that axon's growing and tries to grow a little farther, get itself to a point that it's not in the inflammatory zone or probably the deoxygenated zone. So guess what? About 10% of people say that they felt like gabapentin fixed it, but a lot of them, they didn't feel like they got anything, and they didn't like the side effects from Lyrica. And so that's pretty much the extent. I'm sorry, other than lasers.
Like these big neuropathy centers in LA.
Yeah.
It's mostly drug therapy.
Mostly drug therapy. Mostly drug therapy.
And telling you to start walking, get the circulation going.
Now, mind you, we're one of the bigger neuropathy centers in LA now, so some of us are using laser and just making a joke. It didn't work. Okay. But some of us are starting to use combined medical drug therapy. We just don't use the medical drug therapy anymore. Solely just the laser, nutrition therapy, oxygen, and
it's working.
Oh my God, it's working.
Like all the time.
It's working all the time. The only things you have is the fact that some people, they won't do the homework. But this isn't a get people to do their therapy.
Like eating differently, is that what we're talking about?
You got to, yeah. Most of the American diet, the first 2 chapters in my book are really just all dedicated to the American diet. People are eating too much complex carbohydrates, too much sugars, not enough leafy vegetables, not vitamin D, not things that are giving magnesium. You need magnesium, you need your vitamin D, you need your vitamin B, and you need it at the places.
So you lay all this out for the neuropathy patient.
We put a whole plan together for them so they can see how their bodies.
How soon do they start feeling better? Like that burning that you described.
First 7 days.
Numbness.
Usually the first week. First week. They'll do what I say the first week. You know? Now, if you don't know what PRP is, maybe that first week you don't want to do PRP. I pray that people will just trust us that we're not going to, fool them. Because if they start off and get that PRP, let the nurse practitioner doing it, it speeds up every other piece of healing so much.